Instructor Sam. I'm going to be your BLS instructor today. I'm going to show you everything that you need to know to pass your BLS course. You might be a student who's getting ready to become a med student or a nursing student or a respiratory therapist, or maybe you become an EKG technician, phlebotomy technician. Maybe you're just doing something in the medical field. All healthcare providers should have a BLS, which also stands for Basic Life Support for Healthcare Providers. So I'm going to show you everything that you need to know to pass your course. So as long as you're paying attention to everything I'm saying, there's no reason why you should fail. I am the best instructor who teaches Red Cross classes, American Heart Association classes, the National Safety Council classes, and also ASHI. So if you're going to be working in the hospital, most hospitals tend to only want the American Heart Association. Or also if you're going to any type of nursing program or some type of medical program, they usually want American Heart Association certifications or the Red Cross certifications. So I'm going to be covering everything that you need to know to pass your course. If you feel like that you haven't learned enough, make sure you reach out to me and let me know so I can basically assist you with whatever you're having issues with. So get ready, because I'm getting ready to teach you your BLS. Alright, so we're going to start off with scene safety and assessment. Why is it extremely important to make sure that the area is safe? Well, you don't want to get injured, right? You're a healthcare provider, or maybe you're a pre-hospital provider. You really want to make sure the area is safe. In all CPR classes and anywhere, you want to make sure that the area is safe. Extremely important to make sure the area is safe because you don't want to endanger yourself, right? The next thing you want to do is you want to find out if this patient right here or this person, depends where you're working, right? If they're okay. You could be at home, right? So ask them, hey, are you okay? Are you okay? At this point, it doesn't really matter if the patient's in cardiac arrest where their heart stopped. It doesn't matter if the patient's having a seizure, or maybe it's a diabetic emergency called hypoglycemia where the sugar is low, or maybe the person just got injured from a car accident. It doesn't really matter. You have someone who's unresponsive, you need to call for help. Someone call for help. Help, someone help me, right? So it's extremely important. If you're a pre-hospital provider, you want to make sure you call 911, right? And tell someone else, hey, could you go get me an AED if you work in a clinic or something like that? Now, let's say if you work in a hospital, you want to not call 911. What you're going to do is activate the emergency response team. Hey, you, please activate the emergency response team. And please bring me the defibrillator. The defibrillator is the same thing as an AED. I'm going to talk a little bit more about the AED later on. All right, so the next thing that you want to do is you want to make sure that you go ahead and check the patient's pulse, right? So you want to make sure you check the patient's carotid pulse, which is the side of the patient's neck. So go ahead and check your radial pulse, right? So you feel that blood rushing through your fingers, right? Because it's flowing through your arteries. So same thing. You're going to feel for the carotid artery. Carotid artery. You could check on either side. It's best to check on the side closer to you. So if I was on this side of the patient, I would check on this side. If I was on the opposite side of the patient, I could check on this side. But it really doesn't matter. You want to make sure you check the pulse and look for breathing for no more than 10 seconds. How can you tell if someone's breathing? Well, you can see the patient's chest rising and falling. That is the only way that we really should be checking for breaths, all right? Look to see if the patient's chest is rising. You want to make sure that you check for at least 5 to 10 seconds. If the patient has no pulse and they're not breathing, then you, of course, want to start doing CPR immediately. And that's why it's extremely important to know what to do, right? So scene safety, right? The area is safe. Next thing I would do is tap the patient, ask them if they're okay. Hey, are you okay? Are you okay? The patient's unresponsive. I'm going to summons for help. Help! Someone please, help! I'm going to check the patient's pulse for at least 5 to 10 seconds. At the same time, I'm going to look to see if the person is breathing. I'm going to look for chest rise. Patient's chest is not rising and the patient has no pulse. So I'm going to go ahead and start doing CPR. 1, 2, 3, 4. So let's talk about compressions and why compression is so important. Compressions are extremely important because you need to make sure that you circulate the blood throughout the body. What are compressions? Well, compressions is when you're pushing down on the patient's chest on the sternum, which is also known as the patient's breastbone. You want to make sure that your hands are placed properly on the patient's chest. It's extremely to make sure that you circulate the blood throughout the body within the first 4 to 6 minutes, because what happens when the blood is not moving throughout the body? Well, we have oxygen in our blood. What does the oxygen do for our body? Well, it keeps our organs and our brain cells alive, so it's extremely important to make sure that you're doing your compressions and circulating the blood throughout the body. So that's why I always explain why compressions are extremely important. So I'm going to practice doing compressions. Compressions. So just like I explained in the last section, compressions are extremely important. You want to make sure that you're circulating the blood throughout the body at all times. So I'm going to go ahead and place my hands in between the person's chest, right here, on the breastbone, right here. So when you're doing compressions and you're getting ready to deliver breaths, you should not interrupt CPR for more than 10 seconds. It's extremely important when you're doing your compressions. You do not want to interrupt CPR for more than 10 seconds. If you're going to swap with your partner, you want to go ahead and swap as soon as possible. So I'm going to practice doing compressions. 30 compressions each cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. This is the part where you go ahead and deliver your 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. This is the part where you deliver 2 breaths. Now, you can't interrupt CPR for more than 10 seconds, so I'm going to try to talk really quick. If the patient's intubated and they have a tube in their mouth, you want to make sure that you continue doing compressions. There's no interruption of CPR for breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. What a workout. So when you're delivering breaths to the patient, you want to make sure that you have your pocket mask, right? So your pocket mask is what you use to deliver breaths to the patient. Let's say if you're at the movie theater, the mall, a daycare, a clinic, or whatever the case is, and you receive the first aid kit, and in the first aid kit, you see this pocket mask. Well, you want to put your pocket mask together, right? And then you want to place it over the patient's face. So, as you can see, this is a training pocket mask, but a real pocket mask have a one-way valve. So you're going to place this over the patient's nose and mouth, so if they're bleeding or anything comes out their mouth, it won't go to your mouth. But this is a training mask, so obviously you could see through it and anything could go through this. But like I said, a real pocket mask actually have a valve to prevent anything from returning to the respirator. So I'm going to go ahead and deliver breaths to the patient. How do we know that we're delivering the breaths properly to the patient? You see the patient's chest rise. You want to place this over the patient's nose and mouth, and you want to hold this firmly against the patient's jaw, right? You do what we call the head tilt chin lift. Head tilt chin lift. So you can't pass a BLS course if you're not bringing the patient's head back. You have to open up the patient's airway. So I'm going to go ahead and deliver 2 breaths. 1, 2. I do my 30 compressions, and I'm going to return to delivering 2 breaths. 1, 2. Then I'm going to return to doing my compressions. I just completed my 30 compressions, and then I'm going to return to deliver 2 breaths. Patient's head back. So I shouldn't interrupt CPR for more than 10 seconds to deliver breaths, so I'm going to rush back and continue doing compressions. I'm performing the one rescue technique. So why are breaths so important? You want to make sure that the patient has more than enough oxygen in their body, of course, to keep the organs and brain cells alive. So that's why we deliver the breaths to the patient. The only way that you know that you're delivering breaths properly is if you see the patient's chest rising. Let's say if I was having a hard time delivering breaths and I couldn't get the breaths to go in, well, I'm going to actually just resume doing compressions. Remember, do not interrupt CPR for more than 10 seconds. Compressions are extremely important, even more important than breaths. But if you have the pocket mask and you have a way to do compressions, go ahead. Do the compressions, deliver 2 breaths. So one cycle is considered one set of 30 compressions and then delivering 2 breaths. That is considered one cycle. The second cycle would be another cycle of 30 compressions and delivering 2 breaths. So it's extremely important. When do you stop doing CPR? Well, you want to stop doing CPR when EMS providers arrives, or maybe the rest of the team, or maybe if you're tired. But once you start doing compressions, you want to make sure you continue doing it, because what happens after 4 to 6 minutes, the organs and brain cells start to die. So that's why it's extremely important. Whoa, why is Jim on the ground? Gotta make sure the area is safe. Hey, Jim. Hey, Jim. Are you okay? Are you okay? Miss Thompson.
Yes.
Please activate the emergency response team and get me an AED, please.
Okay, let me call the ambulance also.
I want to check his pulse for at least 5 to 10 seconds. Patient has no pulse and he's not breathing. I want to go ahead and initiate CPR, starting with chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Here's the
Adult
AED machine.
patient.
So go ahead and
If
apply
the
it.
patient is a child, press the child button. Remove clothing from the patient's chest. Press pads
1,
firmly
2,
on the skin.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. Everyone stay clear.
Do not touch the patient. Analyzing heart rhythm.
Everyone stay
Shock
clear.
advised.
Go ahead.
Do not touch the patient.
Everyone stay clear.
Everyone clear. Shock
Patient's been
delivered.
shot.
Begin CPR.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
30. Give 2 breaths.
1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
30. Give 2 breaths.
1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29,
30.
30.
Give 2 breaths.
This is my 5th cycle and we're gonna swap. So guys, I'm gonna show you guys how to operate an AED. The first thing that you wanna do once the AED arrives is you wanna make sure you turn it on. You wanna make sure you follow the prompts and listen to everything the AED is telling you to do, what to do. So if someone is doing compressions, right? Once the AED arrives, we have to turn on the AED. If you have to place the pads around the person who's doing compressions, go ahead. You're a healthcare provider. You can work around each other. Work together as a team, all right? So I'm gonna go ahead and operate the AED. I'm gonna turn it on. Someone just brought the AED, and I'm the only rescuer, so I'm working by myself.
Adult patient. If the
Adult
patient
patient.
is a child, press the child button.
This is not a child.
Remove clothing from the patient's chest.
So if the patient has clothes on, you want to make sure you remove the clothes.
Apply pads on the patient's bare skin. Apply pads as shown in the pictures. Open packet.
On the pads, and let me know where I need to place the pads. So this one said place this one here.
As shown in the pictures.
You want to try to move as fast as you can.
Pads firmly on skin.
This one is circle. Place this pad here.
Apply pads as shown in the pictures.
Place this one here.
Do not touch the patient. Analyzing heart rhythm.
Everyone staying clear?
Do not touch the patient. Analyzing heart rhythm.
Everyone staying
Shock
clear.
advised.
Now tell me
Do
shock
not
advice.
touch the
Everyone
patient.
staying clear. I'm going to pause here real quickly. So why do we say stand clear? Because if someone's touching the patient while someone else goes ahead and press the shock button, that person could get shocked as well. So you want to make sure that everyone's clear of the patient. Even if someone has a breathing device, you want to make sure you remove it. Unless the patient's intubated, and that's totally different. But you want to make sure you clear the patient, make sure no one's touching the patient. Of course, you cannot pause the AED. This is a training AED, so I could pause it and play as much as I need to. All right, so
Everyone clear.
everyone staying clear?
Press the flashing shock button.
Press the shock button. Shocking.
Press.
Boom. The patient
Shock
gets shocked.
delivered.
What will I do after that?
Begin CPR.
I'll continue doing compressions right away. You're doing your compressions right on top of the pads.
20.
You're gonna leave the pads on the whole time. The AED stays on.
2 breaths.
We're gonna go ahead and deliver 2 breaths. Pinch the person's nose. 1 and 2. This is my friend or family. So I'm gonna resume doing compressions.
10.
So the AED stays on the whole time. It's going to reanalyze every 2 minutes or every 5 cycles of CPR. So remember that the AED stays on. So once you turn on the AED, it stays on the whole time. And that's the use of the AED. So I'm going to show you guys how to operate the BVM, the ambu bag, right? BVM, also known as bag valve mask. Bag valve mask, right? A bag valve mask is a device you can use using 1 rescuers or 2 rescuers, but it's really meant for 2 rescuers, especially if you have a patient in cardiac arrest. What does CPR stands for? Cardiopulmonary resuscitation. Cardiopulmonary resuscitation, right? So use this when a patient's in respiratory arrest as well. If a patient has a pulse and they're not breathing, what are you going to use? You're going to use an ambu bag to breathe for the patient. Just remember, the pointy part goes on the patient's nose, right? And the wide part goes on the patient's mouth. You want to make sure that you create a nice tight seal over the patient's nose and mouth to deliver the breaths. You want to make sure you hold it down nice and tight. So when you're holding on to the mask, you want to create what we call the C-E technique, right? So C on top and E on the bottom. Basically, this is where your fingers are going to be on the patient's chin. Right, so I want to show you guys how to use the ambu bag. So you take the ambu bag. You always want to make sure that you're standing behind the patient. You have to stand behind the patient. If there's a backboard here, because the patient's on the bed, remove the backboard or unlock the bed, move the bed, right? So it's extremely important to make sure that you are behind your patient. Just like I stated earlier, the pointy part of the patient's nose, the wide part on the patient's mouth. I'm going to bring the patient's head back and you deliver 2 breaths. 1, 2. Deliver 2 breaths. 1, 2. Hold it nice tight still. 1, 2. So every single time that your partner has just completed the cycle of 30 compressions, you're going to go ahead and deliver 2 breaths. 1 and 2. 30 compressions has just been completed. 1 and 2. So it's extremely important to make sure you use your ambu bags properly. So the 2 rescuer technique, what does that mean? Well, you have 2 rescuers or more, right? Someone is performing the breaths. Someone is performing the skills of compressions. It's extremely important when you have 2 respirators, you want to make sure that you swap at least every 5 cycles or 2 minutes of CPR. So if you heard earlier from Ms. Thompson, she stated, hey, after you reach 5 rounds or 2 minutes, I'm going to switch with you. You could switch out earlier if you're tired. You could also switch out when the AED is analyzing. That's a perfect time to switch as well. So it's extremely important. Never take more than 10 seconds to swap. It's extremely important not to interrupt CPR for more than 10 seconds, which is extremely important. So whenever you have 2 rescuers, one person is actually on the top delivering the breaths to the patient while the other person is there focused on doing compressions. The person who's doing compressions should be counting out loud, right? So if I'm the person doing compressions, I'm gonna count out loud. 1, 2, 3, and so forth until you get to 30, while the person who's delivering breaths is paying attention to the person who's counting. It's extremely important to make sure you're paying attention to the person who's doing compressions, especially if you're the person who's responsible for delivering breaths. So you never want to be that type of person where they say, they get to 30, and you always want to be ready. You always want to have your ambu bag ready, which is also known as your BVM. So you don't want to have your ambu bag here on the ground, and then they say 30, and you're like, So it's extremely important. You always want to be on top of your game. And the only way you're going to be on top of your game is if you're paying attention to everything that's going on, which has everything to do with communication. You place the mask over the patient's nose and mouth. You bring the patient's head back. You deliver 2 breaths, 1 and 2. Deliver 2 breaths again, 1 and 2. Deliver 2 breaths again, 1 and 2. So you always want to make sure you're paying attention. So it's really after every 30 compressions. So after 30 compressions, you want to deliver 2 breaths. That is standard everywhere you go, unless the patient is in what we call respiratory arrest. What is respiratory arrest? Respiratory arrest is when a patient has a carotid pulse, right? But they're not breathing. What happens when you're not breathing for a long time? Well, you start to lose your brain cells and your organs, right? So it's extremely important. So what's going to happen? Things will change. So pay attention. So respiratory arrest, also known as what you're going to use rescue breaths for someone who's in respiratory arrest. So you want to deliver 1 breath every 5 to 6 seconds for adult patients, and for children patients, you want to deliver 1 breath every 3 to 5 seconds for children and infants. For adult patients, you're going to deliver 1 breath every 5 to 6 seconds for someone who has a pulse but they're just not breathing. So it's extremely important to make sure that you continue giving the person oxygen, especially if they have a pulse, because if your heart is beating and there's not enough oxygen in your body, what's going to happen to your heart? It's eventually going to stop. So that's why it's extremely important to make sure that we're delivering those rescue breaths if the patient needs it. But this is really just a section where we need to talk about what are you going to do when you have 2 rescuers. You want to make sure that you swap every 5 cycles. You want to make sure you swap within 5 cycles should be completed within 2 minutes. If you're tired, you can swap. If the AED is analyzing, you can swap. So very important information. This is definitely exam questions. Lunch was great today.
It sure was.
Hold on. This is George. Why is George on the ground?
Oh.
Hold on. Is the area safe? This is weird. George? George, are you okay? Are you okay? Ms. Thompson?
Yes.
Can you activate emergency response team?
Definitely.
And give me the AED, please.
Okay, I'll call 911.
Thank you. I'm checking George's pulse. It's been 5 to 10 seconds. George has no pulse and George is not breathing. I don't see no chest rise. I'm gonna go ahead and start doing compressions. So I'll count to 30. You deliver 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, second cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We're going to switch after the 5th cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. This is my last cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Don't take more than 10 seconds to swap. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2, 3rd cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2. If you're tired, let me know.
Yes.
Alright, so let's switch. So you want to take no more than 10 seconds to make sure you swap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. That way I'm going to do one more cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And that's the 2 rescuer technique.
Ooh, lunch was great.
It was pretty good.
Wait, why is Tom?
Is the Airway safe, Tommy?
Why is he on the floor? It looks safe. Let's go see. Tommy? Tommy? Oh my God.
Tommy, are you okay?
Please grab the AED machine and call 911. I'm gonna check his pulse. There's no breath. He's not breathing. Oh my gosh, he's unresponsive. I'm just gonna start CPR.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1 and 2. I can see your chest rising.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1 and 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1 and 2. So 2 more cycles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1 and 2. So this is the 5th cycle. We're going to switch right after.
4, 5,
6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1 and 2. So let's not take more than 10 seconds to swap. Here you go. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. My 3rd cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Alright, so we're gonna swap after every 5 cycles because this is a child patient. We're still gonna make sure that we're going down at least 2 inches to 4 or 5 centimeters. So it's extremely important to make sure that you're still going down at least 2 inches. 2 inches is the same thing that you're going to do for your adult patients as well. 2 inches for the children, and it'll definitely switch for infants. So you always want to make sure you're doing 5 cycles. If you're tired, you make sure you just swap out early. All right. So what are rescue breaths and why rescue breaths is so important? Well, rescue breaths is something that you do when a patient has a pulse and the person's not breathing. So what are you going to do? You're going to miss their rescue breath. So it's extremely important to make sure that you know what to do. I have a patient who has a pulse, but they're not breathing. You're going to perform rescue breaths. What happens when someone's not breathing and they're not getting a lot of oxygen in their body and the heart's still pumping? What's going to happen? Eventually it's going to stop because of lack of oxygen. So that's why it's extremely important to perform the rescue breaths. How many breaths are you going to give? Well, you want to make sure that you're doing at least 12 to 20 breaths per minute. You're going to make sure that you're giving at least one breath every 5 to 6 seconds for adult patients. 1 breath every 5 to 6 seconds for adult patient. If it's an infant or if it's a child, you want to make sure you're giving 1 breath every 3 to 5 seconds for children, infant. 1 breath every 3 to 5 seconds for children, infant. What happens if the patient pulse stops, right? What are you going to do? You want to make sure you're resuscitation every 2 minutes. Patient loses their pulse, guess what you're going to do? Well, I'm going to start doing compressions. Compressions, 2 breaths. Compressions, 2 breaths. Now we're actually doing our CPR. But right now, I'm going to show you how to perform respiratory. Right? So I have my adult patient right here. You always want to make sure that you're standing directly behind the patient. You put the pointy part on the patient's nose and the wide part on the patient's mouth like I covered earlier. You want to bring the patient's head back. And what are you going to do next? You're going to deliver 1 breath. 1, 2, 3, 4, 5. 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 Deliver 1 breath. Now, if the patient starts breathing normally while I'm performing rescue breaths, I'm going to go ahead and stop performing rescue breaths. So, infant. Who is an infant? Well, an infant is someone who is 12 months and under. 12 months, which is 1 year old and under. You walk into a room, you find this infant on the ground, you still got to check for scene safety, which is extremely important. You want to make sure that you approach the infant and actually tap them on their foot to look for responsiveness. Why do we tap the infant on their foot? Because it's the most sensitive part of their body. So that's why we tap the infant on their foot. The next thing you want to do is you want to go ahead and check the brachial pulse. The brachial pulse is on the side of the patient's arm, just like this. You don't want to check with your thumb being on this side because what happens is your thumb has its own pulse. So that's why it's extremely important to make sure you check with your middle index finger on the side of the patient arm, just like this. All right. You always want to make sure your patient's on the hard surface. I'm checking my patient's pulse and I'm looking for breathing. You always need to look for breathing. If the patient has no pulse or they're not breathing within 5 to 10 seconds and you're the only rescuer in the room, you want to make sure you call for help. Help! Help! Someone help! Ivana?
Yes?
Could you please call 911 and give me the AED, please?
Sure.
Alright. So, and then basically what you're going to do next is you're going to start doing compressions immediately. I'm going to do 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And if this infant is a friend or family, I'm going to go ahead and put my mouth over the infant's nose and mouth and create a tight seal until I see the patient's chest rise. 1, 2, the patient's chest rise, and then I'm going to resume doing compressions. So you do 30 compressions when you're by yourself. But if someone else is with you, you're going to do 15 compressions. The only thing that was done wrong here is once the AED arrived, I should have stopped. I should have stopped to turn on the AED and place the pads. Alright? So if this was a real situation, I would have turned on the AED and actually apply the pads to the patient. And then follow the prompts, and then of course continue doing CPR if it advised me to. But other than that, if there were no AED, I would have just been completing 30 compressions, 2 breaths, 30 compressions, 2 breaths, 30 compressions, and 2 breaths until additional help arrived.
Now I'm going to be showing you guys how to do the 2 rescuer technique with compressions on an infant. So you place your 2 thumbs right below the nipple line and you do 15 counts of compressions. This way, after your first 15 counts, the next rescuer will go ahead and give the patient oxygen. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1, 2.
You notice that the chest went up and down, and then we do another set of 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1, 2. You want to make sure you deliver breaths at least 1 second apart for all patients.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1, 2. You never want to interrupt CPR for more than 10 seconds. If you're having a hard time delivering breaths, the person has to resume doing compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1, 2.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1 and 2. Perfect. Good job. So what are rescue breaths and why rescue breaths is so important? Well, rescue breaths is something that you do when a patient has a pulse and the person's not breathing. So what are you going to do? You're going to administer rescue breaths. So it's extremely important to make sure that you know what to do. I have a patient who has a pulse, but they're not breathing. You're going to perform rescue breaths. What happens when someone's not breathing and they're not getting a lot of oxygen in their body and the heart is still pumping? What's going to happen? Eventually it's going to stop because of lack of oxygen. So that's why it's extremely important to perform the rescue breaths. How many breaths are you going to give? Well, you want to make sure that you're doing at least 12 to 20 breaths per minute. You're going to make sure that you're giving at least one breath every 5 to 6 seconds for adult patients. 1 breath every 5 to 6 seconds for adult patient. If it's an infant or if it's a child, you're going to make sure you're giving 1 breath every 3 to 5 seconds for children, infant. 1 breath every 3 to 5 seconds for children, infant. What happens if the patient pulse stops, right? What are you going to do? You want to make sure you're reassessing the patient every 2 minutes. Patient loses their pulse, guess what you're going to do? Well, I'm going to start doing compressions. Compressions, 2 breaths. Compressions, 2 breaths. Now we're actually doing our CPR. But right now I'm going to show you how to perform respiratory. Alright? So I have my adult patient right here. You always want to make sure that you're standing directly behind the patient. You put the pointy part on the patient's nose and the wide part on the patient's mouth like I covered earlier. You want to bring the patient's head back. And what are you going to do next? You're going to deliver 1 breath. 1, 2, 3, 4, 5. 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 Deliver one breath. Now, if the patient starts breathing normally while I'm performing rescue breaths, I'm going to go ahead and stop performing rescue breaths. So choking. What are you going to do if someone's choking? You're in a room full of people. What are you going to do? Well, if you have someone who's choking, who has a full obstruction, you want to make sure you get that object to come out, right? So it's extremely important to make sure that you perform the proper skills to remove the foreign object, because if you don't get that object to come out, what's going to happen? The person's going to become unresponsive. And when a patient becomes unresponsive, the patient's going to go into cardiac arrest. When a patient goes into cardiac arrest, what are you going to do? You're going to call for help and start doing CPR. So you want to prevent that from happening. And the way you're going to prevent them from happening is actually performing what we call the abdominal thrust maneuver, right? So what you want to do is, if someone is choking, and they, during the universal choking sign, you're accident in the cough, they can't breathe, lack of oxygen going to the brain, the heart. So extremely important for you to make sure that you get directly behind the patient. You're going to create a nice fist, just like this, right? Make sure that the fist is above the navel, just like that. And what are you going to do next? You're going to wrap your other hands around the patient, and you're going to thrust the patient up, like this, right? So you're going to keep thrusting. A lot of people ask, when do you stop actually doing this? Well, you're going to stop performing the abdominal thrust when the object comes out. If the object comes out, the patient will be able to breathe again. But if it doesn't come out, you just continue doing it. If 1 minute has passed and the patient becomes unresponsive, the first thing you want to do is lay the patient down to a hard surface, and then you're going to initiate CPR, starting with chest compressions. You want to make sure that you also activate the emergency response team. Now, what are you going to do if the patient is pregnant? Create a nice fist, place it right there in the center of the patient's chest, take this other hand and wrap it around the patient's chest, and thrust, 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 thrust. You want to make sure you go under the patient's armpit and thrust, and thrust, and thrust, and thrust, and thrust. So two things are going to happen. It's either the object going to come out or the patient's going to become unresponsive. If the patient becomes unresponsive, you want to make sure that you actually look inside their mouth after performing the 1 cycle of 30 compressions, right? So you want to make sure you look inside the person's mouth to see if you see the foreign object. If you do see the foreign object, you want to make sure you remove it. If you don't see anything, don't worry about it. Resume doing delivering the breaths and go back to compressions. Every single time before you deliver breaths, you have to look inside the patient's mouth. This would definitely be an exam question. Make sure that you look inside the patient's mouth to see if you see the foreign object. Please do not do a blind sweep. Only if you see the object visually that you remove the object out, or foreign object, deliver the breath, and continue doing compressions, all right? So even if you see it or you don't see it, you see it, you take it out, you don't see the object, you're gonna go ahead and blow inside the person's mouth, and then of course, then you're gonna see the chest rise, all right? So, good job. What are you going to do if you have an infant who's choking? The mom or dad gives you the infant, or maybe a daycare worker who's already trained in CPR, and maybe they're panicking, and they tell you, here, take the infant. An infant is someone who is 12 months and under. If you have an infant who is choking, full obstruction, unable to cry, they're going to be moving around a lot. So what you want to do is you want to make sure you grip under the patient's chin and place them upside down, just like this. So as you can see, the patient's legs is in between my arms. You want to make sure that you have a seat somewhere, because the patient is going to be moving around a lot. You want to make sure you deliver 5 back slaps. 5 back slaps in between the shoulder blades, as you can see right here. You always want to make sure the infant is slanted towards the ground. Why should you keep the infant slanted towards the ground? Well, if you stated that because we want to use gravity to allow the object to fall out, that's correct. All right, so you want to deliver 5 back slaps, and this patient is responsive. So that's why I'm performing this technique. 1, 2, 3, 4, I'm going to hold the back of the infant's head and I'm going to rotate the infant to the opposite side. And I'm going to thrust. 1, 2, 3, 4, 5. Flip the infant over again in between my arms, right? 1, 2, 3, 4, 5. We'll flip the infant over again. The infant is always faced towards the ground. 1, 2, 3, 4, 5. Then I'm going to rotate the infant over again. 1, 2, 3, 4, 5. What happens if you hear, what are you going to do? Well, that means that the object came out, because now the baby could cry again, which is awesome. Now, if the baby becomes unresponsive, the same baby that was kicking me the whole time, if the patient becomes unresponsive, what are you going to do next? Well, you're going to go ahead and start doing compressions, right? You want to make sure you place the infant down on a hard surface, a table, the floor, or wherever the case is, and you're going to go ahead and deliver the compressions. If you're by yourself, you're going to do 30 compressions. If you're with someone else, then you're going to do 15 compressions. 2 rescuer technique, 15 compressions. If you're by yourself, you're going to do 30 compressions. So it's extremely important to make sure you have everything down packed. Just remember, when you're doing compressions, you're going down at least 1.5 inches to 4 centimeters. So it's extremely important. So going back to the choking, right? So once again, for additional practice, which is great, 1, 2, 3, 4, 5. Rotate the infant again, thrust down 5 times. 1, 2, 3, 4, 5. Flip the infant over again. 1, 2, 3, 4, 5. Flip the infant over again. Thrust. 1, 2, 3, 4, 5. Alright? So if the infant becomes unresponsive and they stop moving, then immediately you start doing CPR, starting with chest compressions. For every patient, for adult, a child, or an infant, you want to make sure that you look inside the patient's mouth to see if you see the object. If you do see the object, make sure you remove it. If you don't see anything, you deliver the 2 breaths, continue doing compression, but you have to make sure you look in the person's mouth to see if the object is there. Alright, so teamwork. Why is it extremely important to know how to work together as a team? It's extremely important for you guys to know how to work together as a team. It doesn't matter if you work in the emergency room, the ICU, the operating room. It's extremely important. You could be working for the police department, or I go to a lot of schools. I teach a lot of teachers and so forth, right? It could be elementary school. Whenever you have a group of people who are together and they don't have clear roles and responsibilities, which you probably see on your exam, clear roles and responsibilities, well, people start to go back and forth. It becomes chaos. Who do you put at risk? The person who's unresponsive or the person who's in cardiac arrest. It doesn't mean that the person has to be in cardiac arrest for people to know how to work together as a team. Someone could be bleeding. Someone could be having a seizure. Any type of emergency, car accidents. You could be an EMT or a paramedic or whatever you are. It's extremely important to make sure that you have a plan, right? Everyone needs to have a clear role and responsibility so the team can function smoothly. It's extremely important for everyone to have a clear role and responsibility so the team can function smoothly. So it's extremely important to make sure you communicate. Communication is everything. You cannot work somewhere and there's an emergency situation happening and you can't communicate with someone else. It doesn't matter if you don't like the person that you're working with, maybe you haven't spoken to them in 10 to 15 years. It don't matter. There's a patient, there's someone who's hurt and sick. You guys better start talking, right? It's extremely important, especially as pre-healthcare providers, pre-hospital providers, or in facilities working in the hospital. It doesn't matter. There's something going on, you want to make sure you communicate that. If you see someone doing something that they're not supposed to be doing, you want to tell them before they make that mistake, all right? Openly, right? In open in front of everyone. You don't have to go back and forth and give anyone an attitude. You want to be assertive. You want to be able to talk to the person. Hey, I noticed that you're giving 18 compressions. Instead, you're supposed to be doing 30 compressions, right? For adult patients. So they'll say, all right, you are correct, hopefully, right? And then they'll start doing the 30 compressions. You cannot jump into a situation or tell someone to move and get out the way and I'm going to take over now. It doesn't work that way. all right? You want to make sure you communicate with the person, all right? Let them know that they're doing something wrong. Give them a chance to fix their mistakes because everyone is not perfect. Another thing as well, you want to make sure that you know what your limitations are. It's extremely important for you to know your limitations. If I'm driving my motorcycle and I happen to fracture my wrist because I fell off, whatever the case is, it's extremely important for me not to be the person who's doing compressions. I'm refusing anyone else from doing compressions. And knowing that I have a fractured wrist that I'm still recovering from, know your limitations, all right? Especially in healthcare, there can be a lot of egos. You want to make sure you know what you need to be doing and know what you don't need to be doing, all right? What you're capable of, right? It's extremely important to make sure that you know what you need to be doing. You must be capable in your skills. If you feel like you can't do a job that you've been assigned to, let's say the doctor say, hey, I want you to go ahead and operate the AED, or hey, I need you to start the patient's IV. If you're uncomfortable with the position that was given to you, right, assigned to you, you want to make sure you communicate that. That has a lot to do with communication. Because in the end of the day, the only person who's going to suffer more than anyone else is the patient. Not only the patient is going to suffer, it'll be the patient's family as well. Because why? The patient families are the ones who have to take care of the patient after the patient come out of the hospital. It's the patient's family who has to stay in the hospital day and night, just sitting by the patient's side. So it's extremely important. As healthcare providers, we do what we have to do, take care of the patients the way they must be taken care of.